Today we'll be chatting with Dr. Kristine Tohtz, who will be teaching a specialty class during our conference this year. Dr. Chris, thank you for talking with us today. This year, during the Fsoma Acupuncture and Asian Medicine Conference, you will be teaching integrative classification and treatment of cervical spine pain. Can you tell us what inspired you and led you to create this class?
Sure. So last year, I actually came to Fsoma and was your breakfast crack of dawn guest lecturer on TMJ when you all were covering integrative treatment for kind of everything that was from the neck up. And I guess the lecture was pretty well received because we were doing an integration of acupuncture needling and how do we look at TMJ from a biomechanical standpoint and how we might be able to do some intraoral and extraoral muscle work to help augment the treatments that you all were learning in your other sessions. Ellen, who's your president, came up to me and asked me if there was a possibility that I would come and speak because you guys were doing integrative, basically sort of musculoskeletal care this year. And I said, sure, I was more than happy to do that. And I specifically asked her, what areas do you feel people complain to you the most about that they want help and support with? And she came back with neck and knee and asked me if I could cover both in 3 hours. And I said, not if you want me to do one well. So we picked neck. And so that's why we're going to be covering neck.
Wonderful. And can you tell us what is the clinical application of this class?
Sure. So this does fall into your biomedical category for classes. So clinical application, I know that a lot of people, and chiropractors included, so I'm a dual licensed chiropractor and acupuncturist. And I know a lot of people sometimes have trouble classifying, like, what kind of movements should we be doing on a patient? What kind of needling might be our best thought process and our best theory? And so what the clinical application of this is we're going to do a lot of anatomy and physiology review. We're going to talk about the differences between the different conditions that we may see in the neck and how they're going to show up, which ones will respond to repeated motion analysis and which ones probably won't, and then how we can integrate trigger point and myofascial needling with traditional TCM needling for your best outcomes for your patients.
Very cool. And what are the benefits of taking your class?
Sure. So the benefits are, I am a big fan of the more tools you have in your toolkit, the more options we have available to be able to help our patients. So at present point in time, I'm a new transplant. I'm originally from Chicago and I moved down to Florida about a year ago. And I've been working as an acupuncturist actually at the Veterans Administration. So what happens is, when we have people come in, right, we're trying to find a way to access their nervous system, to be able to access some type of a lock and key to get in to start to give them back function, because if we can restore function, we can usually decrease pain. So the more tools you have in your toolkit, the better off you are. This turns into an assessment and a treatment capability for you for your patients. Sort of similar to, I know Dr. Anthony Lombardi, who is also a chiropractor and an acupuncturist that's coming in, and he's going to be teaching at the conference on Friday. He's going to be doing a whole day on his system called XStore, which is a great system. And that, again, is just another tool in your toolkit that if, Anthony's system doesn't work, maybe mine will. And if my system doesn't work, maybe Anthony's will. Maybe Matt Callison's system works. Maybe Whitfield Reeves' system works. I don't care whose system you're using. We have to find something to kind of backdoor our way into a patient's nervous system to be able to help restore function so that we can get rid of pain, because that's really why they're here to see us.
Yes, very cool. Thank you for sharing that. And can you share a little bit more about your professional history?
Sure. So I actually started out in my professional career as a chiropractic physician. So I graduated in 2001 from the National University of Health Sciences outside of Chicago in Lombard, Illinois. And about halfway through my schooling, I actually started studying acupuncture. Chiropractic was wonderful and I love it. It's still my first go-to. But I felt like there was some things missing in terms of helpful support for musculoskeletal conditions, but also the biggest thing was for internal medicine conditions. So as I was working toward my diplomate, which is a 300-hour Delphi studied, really tough exam to pass, diplomate exam, once I finally passed that, I sat on the council for a while and helped govern their education, served in all the roles as I moved through. And then my husband, who is now in marketing, at the time he was he was finishing up his PhD in anthropology. We were threatened with moving out of the country about 14 times. And in America, there's still 19 states where you cannot do acupuncture under your chiropractic license. Well, internationally, sometimes chiropractic isn't even recognized, let alone the capability to do acupuncture. And it is so integrated into my practice. I went back to school to get my master's because I wanted to do better. And I wanted to learn herbs, right? That was the big deal and why I went back, because I had a specialty in pregnancy and pediatrics. And I was like, ooh, I want to customize a placenta, right? For placenta encapsulation.
Yeah.
So I went back to go finish my master's, which I'm really happy that I did, because interestingly, in case you don't know, internationally, my master's actually counts for more in many countries than my doctorate in chiropractic.
That is interesting. I had no idea.
Yeah, little did I know either.
So what would you say is the success rate of using your technique and knowledge that you'll be sharing in the clinic?
The nice thing that we usually see right away for patients is if we can find out what, and we're going to integrate 3 different systems in. So we're going to integrate something called mechanical diagnostic therapy, which we call MDT. This is a system that was put together by Robin McKenzie of repeated end range motions. Because the 2 things that are good about this is we can immediately assess what patients should not do, and hopefully what they should do to help centralize or resolve their symptoms. And it puts the key back in their hand for their own healthcare. So because I think a lot of times we get dinged because we do a lot of passive therapy, right? We do things for the patient. And then what's the incentive for them to get better? What's the incentive for them to participate, right? Like whether it's us sending patients home with Qigong exercises or breathing exercises, if they feel better when they come in, why should they do what they're asking us to? Why should they do what we are asking them to do? So this gives them that. So while we've got that coupled together, then we can incorporate in the needling, right? Which then can release some of the musculature, can, decrease the pain, help change endorphin representation in the brain to helpfully help remove some of that fear factor for them, so that we can start to get them to move, or teach them maybe just don't sit like this on your phone all day would probably be super helpful for you. So the system kind of puts those life and life skill things together. And as you get more and more comfortable with it, right, the goal always is let's find the movement that helps decrease their pain. When you get really good at this, when you get troublesome and patients aren't following along, well, you give them the motion that aggravates them, and then you explain to them, well, that's why I told you not to do that. So at least if you stop doing the offending activity, maybe we can make some progress. So we'll at least get it started and get an introduction, and then tell you where to get more.
Wonderful. And to wrap it up, could you share with us a case where you had the best success using the knowledge and information that you'll be sharing during your class?
Sure. So as I explained earlier, right, I work as an acupuncturist at the Veterans Administration, and I had a later 50s gentleman come in, and he's a volunteer that drives the veterans around to their appointments, the ones that can't drive themselves. And so he gets neck pain and numbness down his arm. And right, this is a big deal because he can't check his blind spot, right? And we all know how the driving here is in Florida. So he definitely needs to be able to check his blind spot, but he couldn't turn his head and he couldn't check his blind spot. And he had this pain that kept waking him up at night. So we did this repeated motion to find what was his directional preference, right? And as you come to class, you'll learn what these terms mean and how we use them. So we found his directional preference, and he does the exercises, and I saw him a week later, And he told me, Chris, the pain's gone from my arm. He's like, it hasn't woke me up at night. He's like, my neck is still stiff. He was like, but he goes, generally it feels better. Then we gave him what's called postural correction. I put a little roll back behind his back and sat him up. And he was like, and now all my neck pain's gone. And the rest of this little pain that I get on my biceps is gone. So it's just even these little powerful things to be able to turn around and do that. And then I needled him. And then he got probably about 80% of his range of motion back in his neck, 2 visits. So
That's incredible.
so I mean, if we can make changes for someone that's that strong, right? I always explain to people, my goal is to get you out of my office in 4 to 6 visits. And it was when I was in private practice as well. And it's still the same. I would rather see more people for different conditions than the same person over and over again for the same condition, right?
Yes, I hear you. Wonderful. Well, thank you so much, Dr. Chris, for sharing your time and knowledge with us today.
You are
And
more than welcome. I'm excited to see all of you at conference.
yes, this is such an amazing class. I'm hopefully going to have time to sit down and learn from you as well. So as a reminder, Dr. Kristine Tohtz will be teaching on Saturday, August 26th at 2 p.m. This class is being offered live in Fort Lauderdale Beach, Florida, and it falls under the CEU category of biomedicine for a total of 3 CEU credits. Thank you again, Chris.
I was just going to say, and make sure you bring your kits because we're going to needle.
Yes, that's right. I forgot to mention that. Make sure you bring your needle kit. All right. So Chris, thank you again for chatting with us today, and we will see you all at conference.
Thanks so much, Natalia. Have a great weekend, everybody.
Thank you.